Hi everyone, my name is Stuart Wakefield. I'm a registered kinesiologist here in Ontario, and I'm the Director of Education for a company here in Canada called EBFA Global. I'm going to be doing 2 sessions at the upcoming Canadian Massage Conference. The first one will be called Assessing Our Foundation, really looking at how to assess and understand the foot when we're interacting with the ground. So some of the learning goals that we're going to talk about during that course are going to be the 3 main purposes of the human foot. So we want to look at impact absorption, we want to look at single leg balance, and we want to look at our push off, our propulsion. So we want that thorough understanding of those 3 main purposes of the human foot. So when we're looking at someone, whether it's with someone with foot pain, just any sort of a lower extremity injury that could involve the foot, we want to understand what they're doing dynamically when they're interacting with the ground and interacting with gravity. So we'll look at how the foot should act like a mobile adapter, like a shock absorber. We're going to understand or learn to understand the importance of that single leg balance and how that can help improve both stride speed and stride length. And then of course, we'll look at propulsion, how the foot has to become a rigid lever when we push off the ground. And of course, if we're lacking in any of those areas, what we can do from a training perspective, from a strengthening perspective, or maybe from a mobilization perspective to enhance those 3 functions of the foot. We're also going to dive into the biomechanics of the foot and the ankle. We want to obviously take this comprehensive review and make sure we're all on the same page with regards to some of the complex movements of the foot, like pronation and supination. We need to understand that the rear foot can pronate, it can supinate, but so can the midfoot, right? And those 2 things don't always go hand in hand. So we want to have that thorough understanding of the biomechanics of the foot and the ankle. And then we'll take that information and apply it into a closed chain foot assessment. So we want to have an understanding of what the foot is doing when it's in contact with the ground, and like I mentioned earlier, when we're interacting with gravity. And then lastly, of course, we're going to look at corrective exercise techniques for the foot. Again, looking back at the 3 main functions, is there any deficiencies during impact absorption, during single leg balance, during propulsion? And are there exercises that we can apply from the foot all the way up to the pelvis, maybe the core, that we can utilize to help strengthen those, again, 3 main functions of the human foot? So that'll be the first session that I'm doing at the conference, Assessing Our Foundation. The second one will be called the sensory side of walking. So we're going to look at the importance of the plantar skin with regards to human movement. Of course, we're all bipedal beings. We want to have good interaction with our foot and the ground, and just really understanding what cushion does when we're wearing it on our feet almost 24/7. And that could be socks, shoes, sandals, whatever it is. So we want to have this, again, thorough understanding of impact and the importance of impact on our body. Impact often gets a very bad rap. Everyone wants to do low impact this, low impact that. We want to understand that impact is actually our gift from gravity and the ground, and we need to be able to utilize that and use it to our advantage as bipedal beings. Okay, and then we want to look at the difference between proprioception and mechanoception. I would say proprioception generally gets this kind of global term that is used, all-encompassing term that is used. But we want to look at the difference between proprioception and mechanoception and how we can essentially tap into these mechanoceptors to help our patients move better and to help with many different types of nervous system disorders, such as neuropathies, such as MS, even Parkinson's, lots of different ways that we can positively affect outcomes when we're treating these types of nervous system disorders. And then another one that's very important would be just age-related fall prevention as well. If we can tap into these mechanoceptors, improve this sensory processing pathway to the brain, we can have a very positive outcomes with regards to fall prevention. So we will look at that sensory processing pathway. When information from the ground comes in through my feet, where does it have to go through in the brain to get all the way to that somatosensory cortex and have a positive outcome on my motor patterns, my motor control? And then, of course, lastly, during that session, we're going to look at the sensory motor training techniques. So different exercises, different tools that we can use to, again, upregulate these pathways to the brain to, again, provide better outcomes for our patients when we're simply helping people to walk more efficiently. Maybe you're working with athletes and you want them to run, jump more efficiently. All of this can be accomplished or improved upon if we're integrating a person's sensory system. So I look forward to these 2 sessions at the upcoming Canadian Massage Conference. As I mentioned, I'm the Director of Education in Canada for a company called EBFA Global. I teach many of their continuing education courses for massage therapists, kinesiologists, physiotherapists, personal trainers. And again, our main focus is on understanding the foot, both the sensory and biomechanics, the importance of the foot, and how that relates to human movement and movement longevity as a whole. I teach these courses across Canada, both in person and virtually. If you'd like to check out our company, you can look at ebfaglobal.com. If you'd like to follow me on social media, you can look me up on Instagram, barefoot_Canada, and I'd be happy to answer any questions if you want to shoot me a direct message there.